so 2 people.
I don't care.
Somebody does it on me.
Okay, so Jordan's gonna be the patient, who's gonna be her therapist.
Okay, I'll do
Right.
it.
Or Gracie, you've not been up here. Come on up here.
Here, you want the? No, I guess.
Okay, so let's start relax first.
Well, but the very first thing you do is that, for what we do the first, to start out, just like the pathology, you wanna look at her scapulas.
Oh, okay. So we did mess it up.
So you find, and I don't know the textbook may not have said
I
that, but
didn't.
you always wanna look at this first to get a feel for what, so we're looking for her inferior angle. And sometimes, well, you all done palpation, it's harder to find some people's inferior angles than others.
Yeah. I kind of find the side normally, you just go down.
I got it.
And then sometimes if you protract and retract, you can feel it a little bit better.
Jordans are extremely tiny and up very high.
Yeah, I was about to say, I started so low.
And so what do you notice about Jordan when you look at her? Scapulas. Yeah, they are up high, but how far from the, now, with this test you're getting ready to take, you're measuring how far the scapula is from the spinous process, so you can already kind of start. Yeah.
From this angle over here.
Yes, the right one, her right one's out further than the left, or the left one is closer to the spine. So how would we discern that, or what, how would we know?
Symptomatic side.
Yeah, the
Yep.
symptomatic side. Yeah. And hers do sit high and they sit out.
I'm not really
They're
seeing it.
She's already out far.
She made fun of me.
You're saying the left side is closer to the spine.
That's the right side.
Where's it? Is it okay if I look at their spine?
Yeah.
It's right here.
Yeah, so it's very minimal, but it's a little bit farther over here. Away from the
It's hard to see that and just know it, like for me at least.
Right, that's very minimal, it takes a
Okay.
while to get used to. So, she's in scaption again, coming up. And then she's just, and then watching what's happening. And what I would expect to happen, if it starts out further, you're thinking there's probably more excursion there. Just because it's already sitting out further, that's just an inference that usually holds true, meaning if it's farther out, then it's more unstable. So when they go up, you're probably gonna see a little more movement on the right versus the left. And then it's this, it helps you to see your whole hand, so you can see, because you wanna see your whole hand, because you're watching your whole hand move.
Ready, Gracie?
And it's very minimal, it is gonna be minimal that you see a little more movement on her left. Really try to keep your hands kept. And up. Just kind of follow, feel the blade. So then once you kind of make a note of what's going on, then you can do your measurement. Okay.
So first position is just relaxed. Start. Which, you just say this
Yeah.
is involved side.
And it doesn't matter really which side you start on because you're just comparing the sides.
And going from the interior angle to the further from. Now I got about 7 centimeters for that. And then other side.
Don't forget from still the same landmark. She's gonna go from the, where do you always start at the scapula, then move in, because then you just go to the core
What's the average measurement, would you say? What do you,
I
Is-
just, it,
is
there
random
really,
for
there's not
everybody?
one random.
Okay,
Yeah,
I got
body
that.
type, because of body type and
I could have done that wrong, but I got 7 and 9.
Oh no.
Okay, so.
That probably was my
that-
fault, not.
But that would mean what? Would that be a positive?
Positive.
It has to be
Positive.
greater than
1.5.
1.5 centimeters, so, and you got
7 and 9.
7 and 9. Okay, so that does indicate what we thought, what we thought we were seeing, right? So that would indicate more movement over there. That seemed like quite a lot.
Yeah, no, I
Let
probably,
me see.
yeah. That was probably my first.
Oh, that's okay, I mean, but I do think it's gonna be more over
Look at that wing.
is your right side winged?
You?
Yeah.
You can kind of see it stick out a little bit.
Well, I had one.
How about you?
Way longer.
What did you say? You got in that? You got 10, what did you
Okay,
get?
I got 9.
So you're right.
I got 10 when I did it.
Did you not get a difference?
I didn't do both.
Oh, okay.
And eight.
Okay.
So yeah,
You're pretty close.
so yeah, she's definitely got some more movement over here. So what does that's a positive test for, and we'll say, again, you have to know which side is symptomatic. So just because she was more, movement over here, we're going to say that it's more hypermobility issue, so a weakness of the serratus on that side.
I was diagnosed with a ring scapula 2 years ago, but I had PT for it.
Yeah, on that side.
Get those exercises back
Yeah.
out.
Yeah.
That home exercise plan.
Okay, so the next position, Gracie, or you all can help Gracie, the next position
Hands on the
is,
hips with 10 degrees of extension.
yeah, so your hands on hips and then 10 degrees of extension. And if you're not sure of, if you're getting too much here, because that can skew the results, then you would take a goniometer and have it here and just extend, like it's just the axis is the, here on the lateral side of the shoulder joint. Both arms of the goniometer are down, and then you move the movable arm with the upper arm.
Would you say it was a positive for? You said it was a positive for weakness of the serratus on the hypomobile.
No, the hyper, the right
Hyper,
side.
okay. But since it wasn't a centimeter 0.5 difference, it would be negative still, though, right?
If what?
If it since it wasn't greater than a 1.5 centimeter difference,
It
it'd still be.
was.
Oh,
It
was it? Oh, okay.
8 and 10.
Oh, okay.
So we just said, well, yeah, cause it was between, it was like 9.5, so.
Okay.
Okay, I got 8 on one side and like 9.5 on the other.
Okay, so 8, 9.5, would that then be positive or negative? Well,
Both.
it has to be greater than, so she'd be right on the cusp of negative. But if it were positive, then you're looking at weakness of the rhomboid and middle trap. Here.
And then arm side, and then thumb down. Sorry. Okay, do that again, sorry, I'm gonna find it again.
And be thinking about, I don't think your textbook talks about weakness here, but what would be weak if she can't, if she's got instability showing here?
Her deltoids.
But think more of this motion here,
Spinatus.
Subscapular.
subscapularis, because she's internally rotating.
So positive here, it's weakness of subscap.
You're right, and what of the scapula though? they're still thinking about what other scapular muscle would be weak if she
Okay.
can't,
Yeah.
when she's doing this.
Besides the subscapularis?
I said there's a scapular muscle, it's a rotator cuff and then the scapular, because what's happening here, feel of your scapula when you do this.
Maybe like levator scap, maybe?
Aries major.
Scapular, I think like, well, think scapular, is it the levator scapula, is it the upper trap, the lower trap, middle trap,
Sorry.
rhomboid, serratus,
Upper trap?
upper trap, yes.
No, I got 10 on this side and 11 on this side. For that.
And like, so that would be negative for her upper trap. So her upper trap's in good shape, her rhomboid and middle trap were okay, but then she's still, the serratus was what was weak. Which was what, again, when I very first looked at her, I knew there was something going on there. That's why it's important to get used to using your visual, of their biomechanics, what's that telling you before you even measure.
Subscapulars. It is subscapulars and upper trap for the third. Okay.
There, in that, if it's positive in that position. So with that test, the biggest disadvantage of this test is that it can be negative and there's a pathology present.
So it can list stuff.
Right, postural, lots of times postural, because, and think about what it, to be positive, there has to be what? That
1.5 centimeter difference.
right difference. But what if somebody has kyphosis? Will this test be positive?
Yes. Well, it could be.
Well, think about it. If they have kyphosis,
It'd be on both sides of the no.
it'd be 11 and 11.
Is there no such thing as like uneven kyphosis?
Not usually.
No.
No, they wouldn't name it that. There are people who do have the look of like they have, you know, one rounded shoulder, but it's usually due to like spasticity on one side. So they don't label it as like that unilateral kyphosis. But so there, and then what if they're just weak, have weak serratus bilaterally? This test would then be negative. So they definitely could have postural issues going on, and this test will say that it's negative. But the example is kyphotic patients will have a negative test here. And that when they definitely have weakness of the serratus for sure, and probably all the rest of the scapular muscles are weak as well. The positive of this test is that it does look at that multiple muscle weakness because it has the different positions. So you can pull out isolated weakness good, well adequately with this test. The other positive, now with kinesiotaping being used a lot, it allows for clinicians who do a lot of that taping to know how severe the weakness is and how hard to pull that tape, how hard it tends to tape. Because if it's, you know, a 2 centimeter, 2.5 centimeter difference, then you know there's quite a bit of weakness in comparison to the other side. So here's where that comes in. If it is positive for hypermobility of the scapula, meaning it's too far away, then what could be going on? It's kind of how we opened, and we're closing the lab today with what I opened with. But if you have a scapula that is moving too much, that can indicate secondary impingement or weakness of the scapular stabilizers in general. And then the other example I gave you was the subluxation or dislocation of the shoulder. And everything's real moving around there. And the other, if it's this scapular excursion. So with that being said, if the scapula is moving too much and this test is positive, then what other tests, when you read the evaluation, could also be positive?
With the mobility indicates shoulder impingement. It could probably just be any of the
Any of
shoulder.
those, good, yeah, any of those. And then we didn't get to, the apprehension and relocation test, but that's testing for, shoulder dislocation, subluxation. So those two tests, if they have, if the lateral scapular slide test is positive, then the apprehension test could be positive as well as all the impingement tests.
Did you say a disadvantage for the lateral scapular slide test?
Hello.
A disadvantage for the
I
scapular?
did, yeah, I said that it could be negative, but pathology present, like kyphosis.
Okay.
If it's negative, then they could still have kyphosis, but the test would be negative. And then if this test tests out, the scapula too close to the spine, meaning there's tightness, the two diagnoses there that could be present would be the ones I gave you when we first started this afternoon,
Capsule restriction.
which, yeah, what's the name for that? They have contractures and adhesions,
Adhesive capsulitis.
adhesive capsulitis, because if they have adhesive capsulitis, everything's gonna be stuck, so that scapula's gonna be really stuck to the thoracic wall, closer to the spine. Good, yes, upper motor neuron, like CT, or a stroke, like a CDA, where they've got spasticity. This test would be positive, but it would be positive and the smaller value would be on the symptomatic side. Okay, are there any questions about that? Okay, so when we come in lab after the break, we have spring break coming up, I'm sure you're all excited about that. After the break, we'll pick up on the shoulder exercises, make sure you look over, I'll do the apprehension test the next time we're here. But we'll go over those exercises the next lab, and I also posted the elbow, wrist, and hand special tests and exercises, so that's how we should be able to get through those on the next, on Monday's lab when we get back from break. And as promised, the shoulder, because we missed for the practical on Monday, there will be a video lecture posted of the shoulder information. Okay? All right.